In this video, we'll discuss about glomerulonephritis. Glomerulonephritis is a term used to refer several kidney disease, usually affecting both kidneys. Most of the disease are characterized by inflammation, either of the glomeruli or small blood vessels in the kidney. So, most of the disease are characterized by inflammation either of glomeruli or small blood vessels in the kidney. These glomeruli remove excess fluid, electrolytes and waste from bloodstream and passes them into our urine. So these glomeruli remove excess fluid, electrolytes and waste from our bloodstream. It will pass us in the form of urine. It having two types: acute glomerulonephritis, chronic glomerulonephritis. Suddenly it will cause us means acute, by gradual it will cause us means chronic. What are the symptoms will causes this glomerulonephritis? Pink or coke colored urine from RBC in urine hematuria condition, then foamy urine due to excess protein urea condition, then high blood pressure because of hypertension, then fluid retention. It will causes because of edema. So what are the symptoms? Pink or coke color urine, that condition hematuria condition, then excess amount of protein urea condition, then high blood pressure and fluid retention, edema. So these are the symptoms. Next, causes of glomerulonephritis. First one, because of infection. Mainly that group A hemolytic streptococcus can grow in pharyngeal region for 1 to 3 weeks. After that, it will causes that streptococcus glomerulonephritis, mostly in children's. So group A hemolytic streptococcus can grow on that pharyngeal region for 1 to 3 weeks. After that, it will causes glomerulonephritis mainly in children. Then bacterial endocarditis. This bacteria can spread through bloodstream. This streptococcal glomerulonephritis. This streptococcus bacterium can spread through bloodstream and lodges in heart, causing an infection of one or more heart valve. So this bacterium through bloodstream, it will reach to our heart. After that, it will causes infection. Then viral infection, that human immunodeficiency virus, hepatitis B and C causes that glomerulonephritis. What are the virus? HIV, hepatitis B and C will causes glomerulonephritis. Next, autoimmune disorder, lupus, the systemic lupus erythematosus, that one. It is a chronic inflammatory disease. Lupus can affect many part of that body, including skin, joint, kidney, blood cells, heart and lungs. So this one is chances for glomerulonephritis. Next one is good posture syndrome, is also known as anti-glomerular basement membrane disease. It is a rare autoimmune disease in which antibody attack that basement membrane in lungs and kidney, leading to bleeding from the lungs, glomerulonephritis and kidney failure. It is a good posture syndrome is a rare autosomal rare autoimmune disorder in which antibody attack that basement membrane of the lungs and kidney, leading to bleeding from the lungs, glomerulonephritis, and it will causes kidney failure. Rapidly progresses renal failure. Next one is IgA nephropathy. IgA nephropathy is a chronic kidney disease. It progresses over 10 to 20 years. After then it can leads to end stage of renal disease. That IgA nephropathy, it is a chronic kidney disease, progresses over 10 to 20 years. After that it can leads to end stage of renal disease. It is caused by deposit of that protein immunoglobulin A IgA inside the filter glomeruli in the kidney. So in this condition it will causes hematuria, proteinuria. So IgA antibody deposit inside that glomeruli. So in this condition hematuria, proteinuria it will causes. Then complication, acute kidney failure, loss of function in the filtering part of that nephron can result in rapid accumulation of waste product. Acute kidney disease, loss of function in that filtering part of that nephron can result rapid accumulation of waste product, so need emergency. So here for treatment we need dialysis, removing extra fluid and waste from blood. After that by using artificial machine we can remove that waste material. So loss of function in that filtering part, that nephron, okay, so affected, so that reason rapid accumulation of waste. So by using artificial method we can remove that waste product, artificial kidney machine. Then chronic kidney disease, kidney gradually lost their filtering ability. So gradually our kidney lose that filtering ability. In this one by using clearance test, that creatinine clearance test, inulin clearance test, we can estimate clearance value more than 90 percentage means renal function is normal. 60 to 90 percentage means mild renal impairment. 30 to 60 percentage means moderate renal impairment. 30 percentage means severe renal impairment. Less than 15 percentage means renal failure. This one is the end stage. So 30 to 60 percentage moderate renal impairment, less than 30 percentage severe renal impairment, less than 50 percentage renal failure. So here dialysis or kidney transplant needed. Then high blood pressure, damage to kidney, resulting buildup of waste in the bloodstream can raise our blood pressure. High blood pressure, damage to kidney, resulting buildup of waste in the bloodstream can raise our blood pressure. Nephrotic syndrome is often caused by causes the body to excrete too much protein in that urine. Nephrotic syndrome, it is a kidney disorder that causes the body to excrete too much protein in urine. Damage to small blood vessels in the kidney that filtered waste and excess water from the blood. Damage to small blood vessels in the damage that filtered waste and excess water from the blood. It can be associated with high blood cholesterol and swelling, edema. So this one is associated with high blood cholesterol and edema. Next, diagnosis of glomerulonephritis. First test, urine test. A urine analysis must show red blood cell and red cell cast in our urine. It indicate possible damage for glomeruli. So urine analysis, red blood cell and cells are cast presented in our urine means it indicate damage of glomeruli. White blood cell indicate filtration or infection or inflammation. Suppose white blood cell is presented means it indicate infection or inflammation. High amount of protein presented means nephron damage. Increase blood level of creatinine or urea and or red flakes. These are the condition we have kidney disorder. So here red cell indicate Red cell and red cell cast indicate that damage to the glomeruli. White cell indicate infection or inflammation. Protein indicate nephron damage. Blood level, increased blood level, creatinine, urea, and red flag. These are the things presented means we have kidney related disorder. Then kidney biopsy. Kidney biopsy is almost always necessary to confirm a diagnosis of glomerulonephritis. So this method we are using needle to take small piece of kidney tissue for microscopic examination to help determine the causes of inflammation. Blood test kidney damage and impairment of glomeruli by measuring level of waste products such as creatinine, blood urea, nitrogen. Blood test kidney damage and impairment of glomeruli by measuring level of waste products such as creatinine, blood urea, nitrogen. Other test by using X-ray, CT scan and ultrasound.